Welcome to Ararat Healthcare and Charcos Learning Centre, your one-stop solution for IELTS, OET, CBT and OSCE training, as well as recruitment to achieve your dream to be a registered nurse in the UK. To enhance your chances of passing your OSCE on the first attempt, please visit our website on www.charcoslearningcentre.com to register and book our unique OSCE portal consisting of videos, reading material and quizzes. This registration not only gives you access to the portal, you will also receive 5 complimentary online classroom-style sessions and a mock OSCE test. So don't delay, you're achieving your dreams any longer and sign up now. ANTT. Okay, no matter how you've practiced, the principles are the same for ANTT. So please don't be thrown if you get given an arm wound or a leg wound, or no matter where the wound is, it's the same principles. You need to demonstrate your sterile environment, your clean hand, dirty hand, and making sure you're not contaminating everything at all. Bear in mind, you may need to start this process and this procedure from different stages, so practice doing it with all the introductions and gaining consent, etc. And also practice from when the dressing has been removed. For if you are given the wound assessment to do prior to doing the ANTT, there will not be a dressing to be removed. So make sure you've practiced from these steps so that you're prepared for whatever comes at you on the day. So I'm entering the room, checking for scene safety, doing my hand hygiene before I approach my patients. Then palm to palm to dorsum, fingers interlaced, fingers interlocked, rotation of the thumb, tips of the fingers, and finally the wrists. Good morning.
Good morning.
My name's Julie. I'm one of the nurses here looking after you today. For my clarification, can I just confirm your full name and date of birth, please?
Yeah, my name is Raj Palmer and date of birth is 20th of November 1962.
Lovely. And what can I call you?
You can call me Raj.
Okay, Raj, I'm just going to cross-check that with your wristband. So, Raj Palmer, 20th of the 11th, 1962, and your hospital number is M45673P. Super. Right, I understand the doctor's just been here and had a look at your wound, so you need a new dressing, is that right?
Yes, it is.
Okay, I'm going to come and do that dressing for you, but before I do that, I'm going to take update your wound assessment. The whole process is going to take about 10-15 minutes, so do you need anything before we start?
No, I'm fine, thank you.
Okay, before I proceed with the dressing, do you have any allergies at all, Raj?
No, I'm not allergic to anything.
Fantastic, even adhesives, dressings and things like that? No?
Yeah, I'm fine. Yeah.
Perfect. Okay, so I'm going to go and get gloves and apron, and I will come back to do the wound assessment. Is that okay?
Okay, that should be fine.
Before I go, I'm going to leave you with the call bell, so if you need anything at all, just pull the call bell.
Okay. Okay.
And I'm going to provide privacy by closing the curtains, and I'll be right back, Raj.
Okay.
So I'm going to do my hand hygiene. If there was a sink available, I would do a full soap and water wash, but as not, I'm going to use a hand gel just to make sure my hands are clean before grabbing my apron. And a pair of gloves. Good. Hi Raj, I'm back. Are you happy to proceed?
Yes, I am.
Okay, so I'm just going to expose your wound here. Okay. So we're looking at a 48-hour post-op surgical wound. Is that right, Raj?
Yes.
2 days ago? Okay. So I can see got a little bit of reddening around the actual surgical site. And there's a gaping at the end, the bed of the gaping there, just at the distal port, right? There's a small area that hasn't quite healed. The rest of it appears to be healing really well. Don't worry about this end bit because it does look clean and red and healthy. There's no sign of pus or any exudate there at all. So I think that one just needs a little bit longer, and we'll keep a close eye on that bit, okay?
Okay.
Right, can I ask you, do you have any pain over the site?
Only a little bit, not too much.
And is it there continuous, or is it only when we're changing the dressing?
Mostly if I move or when the dressing is being changed.
Okay, can I ask you to rate your pain, with 0 being no pain and 10 being the worst pain imaginable?
I would say it around 3.
Okay, lovely. Have you had any painkillers this morning, Raj?
Yes, I think that I had some.
Okay, are you happy for us to proceed and get dressing over there?
Yes, please go ahead.
Okay, so I have on a clean pair of gloves and an apron, and I'm going to clean my trolley, which I can confirm has been washed with soap and water within the last 20 hours. So I am going to use some 70% wipes to clean it off, checking the expiry date. Here. So I've taken 3 wipes, and I am going to clean the trolley from top to bottom, from furthest to nearest in a zigzag manner. Okay, so starting at the back in a zigzag manner, making sure that I have cleaned thoroughly, and turning the wipe over, I am going to clean the back legs. And taking my next wipe, guarding that one, I'm going to clean the front legs, turning my wipe over and cleaning from the furthest to the nearest in a zigzag. Going to discard all of that. Finally, with my last wipe, I am going to clean the spout with my alcohol gel and place that on the bottom of my trolley. I'm going to discard the spout and apron and do my hand tugging. I'm going to gather the equipment I need for the procedure, and for that I need a wound dressing pad. Need to check that it's intact and in date, expiry date 07/2022, and I'm going to place that on my trolley. I'm going to get the right size dressing, which I've confirmed with the wound care plan. So I've got a surgical meatball dressing here and the right size. Checking that it's intact and in date, expires 11/23. I will need an alcohol swab. So I'm checking that it's intact and 07/24, and I will need a sachet of normal saline, making sure that there's no cloudiness or participate in there, and checking that the date on this one, which expires 04/2022, so I need both of those on here. I will need a clean apron, and I will take a spare pair of sterile gloves with me just in case I have a problem with the sterile gloves in the pack. I'm going to take the wound care pan with me in case I need to refer to it whilst I'm there as well. And now I'm ready to go back to my patient's bedside. And I am entering the room, trying to not disturb the curtain too much. Hi Raj, I'm back.
Hello.
Are you still happy to proceed?
Yes.
Okay, so I am just going to get everything sorted here. So I am going to open my dressing pack away from my trolley. And I'm going to tip it out onto my sterile surface, making sure the outer packaging doesn't touch. And do my hand hygiene once more. And before I proceed any further, I will put my clean apron on. What have I got left under here? I am going to open my sterile field, touching the outside of the packaging only. Now, as I want access to this bag, I am going to gently, if I can, without contaminating the area. That's what I want. Okay, so I have got this sterile bag. I am going to use this bag as a sterile glove. To arrange the articles on my sterile field, making sure that everything stays within the sterile field. And trying to touch things as least as possible. I'm now going to use this, Raj, I'm going to take away this drape here, okay? Might feel a bit strange coming from the leg there. And I'm reversing the bag. And I am going to use the sticky tape to secure the bag here, which I will now use as my rubbish bag. And I need to make sure that that is in between the patient and my sterile field. I'm going to redo my hand hygiene. And I am going to get my dressing. Again, I'm going to open this away from my trolley. And I'm going to tip it safely onto my thing and stick that in the rubbish. Once more with the hand hygiene, I'm going to take my alcohol swab, and I'm going to clean the opening for 30 seconds and allow it to dry for 30 seconds. And carefully, I'm going to open it and pour into my pot, making sure not to make any spillages. And now I'm ready to proceed. So hand hygiene one more time. Okay, making sure that my hands are completely dry. I am going to put on my sterile gloves, making sure that the first one I touch the inside of the glove only. If I can find my thumb hole. Still touching the inside of the glove only. Now on this one I'm going to touch the outside of the glove with my gloved hand, so not to contaminate my gloves in any way. Now that I have them both on, I can make sure that my wrists are adequately covered. I am going to place a drape adjacent to my patient. I'm going to make sure I do this by not contaminating my gloves in any way. Normally I would ask the patient to lift if they're able to, or have some assistance to do that, but at this I'm just placing this here without contaminating my gloves. Okay, so first things first, I am going to use this as my clean hand, which will stay only on my sterile field, and this as my dirty hand, which will be going to the patient. I'm going to move that away. Okay. Take one piece of gauze, I'm going to squeeze. As we've already assessed Raj's wound, and we have been aware that it is appearing to heal nicely, I am going to clean in a linear fashion from the cleanest end to the dirty end in a linear motion, and dispose in the rubbish. I'm going to do one more. Raj, it is healing well. I'm not going to over clean it because cleaning can sometimes disrupt the healing process. Okay, so I am going to do one more clean and dispose. Then I'm going to take a dry gauze, which I am going to dry. Now, with my clean hand, I'm going to pull half of the backing of the dressing off. And making sure that my dirty hand only goes on the outer aspect of the dressing, I am going to place this over the wound, securing it with the back of this hand, so it's my clean hand that's going near the wound to take off the final dressing backing. And I'm going to secure that on here, making sure that there's no creases on there. That's done, Raj.
Oh, that's good.
Okay, I'm going to take this away, put this in here. I'm going to get rid of all of my equipment. How does it feel, Raj?
Yeah, it feels alright.
Not too painful?
No.
You don't need any painkillers or anything?
No.
Okay, so I'm going to take off my gloves and my apron, and make sure that this rubbish bag is sealed. I'm going to do my hand hygiene. And I'm going to cover you back up, George. Okay?
Thank you.
I'm going to update your care plan and your nursing notes to say that I have done the dressing, and I think that one will be safe unless it gets wet. That one's all stay for another 3 days.
Okay.
Are you comfortable?
I am.
Is there anything you'd like me to get for you before I go?
No, I'm fine, thank you.
Okay. In that case, do use your call bell if you need anything, Raj, and I will be back with you later.
Okay, thank you.